to. But anyway, here we go. Well, I'm so glad that you took the time out of your busy schedule to be a part of my podcast. I really am excited about asking you some of the questions that are really uh, people really want to know about. What are doulas? Can you give us a little information about yourself first?
Yeah, yeah. So I actually have been a doula for many years now. And I've been working in this equity space for infants and mothers for about a decade. And what brings me to this work is actually I lost my daughter when I was 9 months pregnant, a decade ago, a little over 10 years ago. And it was preventable. It was a instance where a doctor wasn't listening. And after that happened, I realized how often this happens to Black and Brown people. And it made me want to be an advocate and bring more people into advocacy in this space because there was not a lot of diversity amongst the folks who were working on these issues. That community voice was missing from this issue. So that's a little bit about how I got into this.
So, how did the Wichita Birth Justice Society get formed, and what was the inspiration on that?
Yeah, so it came together in 2019 and 2020, about 3 or 4 years ago. And we actually, for a year and a half now, we've been Kansas Birth Justice Society. We expanded our scope statewide and even changed our name. But
Oh,
we came together initially with the thought that we have some tools and some ways to reduce these disparities and actually make a real difference in our community and do it in a way that's led by the people in the community rather than by an overarching entity like a health department or a state agency or organization. This is a different kind of work. This is us in the community being the boots on the ground.
so what are the duties of a doula? I mean, how does that work versus a woman who is pregnant and goes to a public uh, facility? How does that work?
Yeah, so a doula does not do anything medical. A lot of people get doulas and midwives mixed up. A doula is a medical advocate. So it's very similar to if you had your auntie or your cousin who is a nurse with you while you're having a baby. It's that person who's there, who's going to be the cheerleader for you, who's going to make sure that whatever system you're in, whether it be a midwife with a home birth or a physician in a hospital, whoever's handling your care, that they're doing it respectfully. And so the midwife is the person who's kind of replicating that traditional role. We've
Okay.
always, I meant doula, not midwife. But, so the doula is really very similar to what our community has had in the past. You know, people have always had that skilled cousin or friend or aunt who was going to be in the room with you when you had your baby. That elder woman who could say, this is how things usually go. This is what to expect, and then is there for you, is rubbing your back, is making sure that your mom has what she needs, is making sure that everybody's being treated well, making sure that you know all your options. And that's really important because what's happening in these hospital systems is people are not always being heard. People are not always being treated well.
Right, right. So, are there any training for doulas? I mean, do they get some kind of professional training, or how does that work when it comes to? Because I'm back of the age where uh, my aunties and my mother and all of them they grew up in the country and they had their babies in the country. They didn't have hospitals and all of that kind of stuff. So I don't know how they got the midwives got their training, but how do they get their training to
Yeah.
be a companion for pregnant mothers?
So the what I say is most of the training to be a doula is already in us. This is a role within the community. It's just another name to call it. But
Yeah.
we actually provide professional doula training at Kansas Birth Justice Society for people who want to make this their career, for people who want to work with others beyond just those in their family or in their circle of friends. And it's a different kind of training. It's not like something that you would get when you go to nursing school. You know, we're talking about how we can navigate within these systems and how we
Mhm.
can change the systems from the perspective of somebody who's not working for the system. You know, your priorities are different when the hospital's not the one writing your paycheck. You know, when you're hired directly by the family, you're there to support that family, and nobody can tell you otherwise. But this kind of role is, you know, like I keep saying, it's not new. Uh, what we're hoping to do with this is to make changes where they're needed most. Because, like you said, it didn't used to be like this. We didn't used to birth in these hospitals. It was actually 1921, a law was passed called the Shepherd-Towner Act. Uh,
Mhm.
have you ever heard of that?
No.
Most people have. It's suppressed history. This is another thing, people, the history of it has mostly been buried. 1921, what happens is the federal government and some second wave feminists, or I'm sorry, this was actually first wave feminists. This was way back a century ago. They
Mm.
decided that they were going to regulate maternity care. So regulate the practice of taking care of people while they're having babies. And so they, for the first time, made federal subsidies to pay maternity care nurses, and they regulated who could catch the babies and where they could be caught. And
Mm.
within just a couple decades, all of the midwives who had been community-based, people just in our community who were kind of embedded, all of them had to either go underground or go out of practice because they stopped issuing midwifery licenses. And that was the turning point where we see these disparities skyrocket because for the first time, Black and brown babies were not being caught by Black and brown midwives.
Okay. Okay. So I know you're talking, your center is trying to reduce the mortality rate of infant births. So does a doula help with that? Are they better with doing that versus in the hospital?
So the doulas actually go in the hospital with clients. They're not the
Oh, they
ones.
do go in the hospital. They
Mhm.
don't actually be at
They
the house, be in home. I thought it was mostly the doulas go to the home, but they go to the hospital too.
So doulas, since
Okay.
doulas aren't providing medical care, they're just an advocate. They go wherever the healthcare provider is that family
Wow.
hired. So sometimes that's home births if they've hired a midwife, and sometimes it's in the hospital if that family has hired an obstetrician. Now midwives, we need more of them too. So
Hmm.
they're the ones. Some of them work in hospitals. Some of the midwives do home births. I'm actually working on finishing up my midwifery training right now, and I'll be the first midwife of color to be in the Wichita area in generations,
Oh,
um,
wow.
at least since the 1930s. And we need more of us out here.
Well, I kind of had doulas kind of switched up, mixed up. I thought a doula took the place of a midwife and that you help with the birth at the home specifically. I didn't know that they were more of a support system versus actually doing the work of a midwife. So that thank you for clearing that one up because I had it all mixed up there. I really did.
Most people do, and most people think, well, a doula isn't for me if I don't want to have a home birth, or a doula isn't for me if I have a high risk pregnancy or if I have this complication. But actually, doulas work in all those situations. You know, we're doing all the stuff that the medical system does not tend to. You know, the
Mm.
medical system isn't going to sit and pray with you usually. The medical system isn't going to rub your back or make sure that you have a birth plan together or make sure that your mom is comfortable during the birth. You know, all those things that are still really important that still need to happen. The system overlooks, but a doula
Mm.
can do it.
Oh, wow. Well, that's good. So how long is a training, or is there a training? Or are you looking, like you said, you're looking for more midwives? Are you looking for more doulas as well?
Yeah, we're always training doulas. So our training, the next cohort won't start probably until next month. And it's mostly a self-paced training online, and it does have 2 weekends worth of in-person content too. But it's typically about 6 months for our training from start to finish.
Wow. 6
Vers-
months.
it seems like a long time, but we're really serious about training people, making sure that they have all the information on the standard of care, because we're having to make sure that the standard of care is met. Basic standard of care in these hospital systems. And these are lives that are in the balance.
Absolutely. Absolutely. That's why I was wanting to know with that earlier question, have you seen a reduction of infant mortality rates with doulas and midwives versus the hospital? Have you
Yeah.
seen any? Okay.
So we have not had a researcher work with our data yet, but what we've been able to do with our program locally is reduce things like C-section rates, reduce the
Mm,
number of us that are having issues with preeclampsia, gestational diabetes, and those things in turn lead to healthier babies as well. Because when we're healthier through our pregnancies, the baby has time to grow. The health of the mother has everything to do with the health of her baby.
absolutely. Absolutely. Well, that's interesting as well because when you're saying uh, the reduction of hysterectomies, because I know back in the day uh, there were a lot of women getting hysterectomies, and some of them didn't survive because of how the hospital handled the situation.
Yeah, the history of these hospitals, we see 100 years ago when that Shepherd-Towner Act was passed, when these hospitals first sprang up, what they were designed to do was be places for these new doctors in residency, so in their specialty training, to get practicing on humans, on human
Mm,
bodies. And the
mm,
people forced into these systems, into these so-called teaching hospitals, were by and large Black and brown folk. Uh,
mm.
and it literally was our bodies being experimented on, these new doctors learning on our bodies. And
Yes.
in Wichita to this day, both of our hospitals that have labor and delivery wards are teaching hospitals. And so it's still happening to this day. You walk in either one of them, and it doesn't matter now what socioeconomic class you're part of, because the doctor providing that hands-on care isn't actually the doctor that you've hired. It's the resident doctors in the hospital that are learning under the direction of your doctor.
Wow. That's interesting as well because when I had my first child, I went to a general hospital, which was a public hospital at the time. And I was in the labor room with at least 5 other women. We didn't have a private room or individual room, it was 5 other women. So by me not knowing what to expect, from having a baby and the pains and whatever. I was hollering and screaming and carrying on so that the doctor finally came in and told me to be quiet because I was scaring all the patients. And so a doula would have been just great for a young mother such as myself and the other women that were in there to kind of uh, kind of support me through what I was going through because we didn't know what to expect at all.
Yeah, the way that birth is done in the hospital is definitely more violent than how birth used to be done. But before we had all these doctors and before we had, surgical units, our bodies were able to birth. Our bodies have always been able to birth. In this country, we do too many C-sections. The World
Mm,
Health Organization says that in any industrialized nation, that the C-section rate, including all those instances where there really is a true medical emergency, should be 10% or less. But
wow.
here in Wichita, Kansas, we have some of the highest rates in the entire country, and it's been as high as 40% before. And that it's a big problem because when you have a C-section, that's a harder recovery, and you're
Right.
14 times more likely to die in the process of childbirth if you have a C-section.
Oh my
So,
God.
yes, and many of them are unnecessary. Because for a physician, it's 2 hours scrub in to scrub out, and they're finished with that patient. Versus if you're laboring and you're wanting to give birth vaginally, as you know, that could be a longer process. Most people don't give birth within a span of 2 hours, it could be up to 2 days, sometimes longer. And so we're incentivizing physicians to not do the right thing. We're incentivizing them to do more C-sections. They get paid more for them. It's quicker for them. It's easier for them.
And that's crazy because my mother had 4 children naturally. And then her last 2, they did cesarean sections. So I would think that the only way that a woman should have a cesarean section is her health is in danger, or her life rather is in danger of in order for them to do that. So just to hear you say that they do it because sometimes they get paid more and then it's quicker. That's crazy. That's really
It,
crazy.
it is. I think, the one positive thing that has come out of this is people are starting to be louder about that, about the fact that many of these are unnecessary, and that as a society, as a nation, this is not something that should be going on here.
Mm-mm.
That it doesn't have to be like this,
No.
but it used to be after you had one C-section, every baby that came after that had to be by C-section as well.
Wow.
Because
That's
they were worried
crazy.
about it rupturing, where you had the incision before. But
Mm-hmm.
now you can do what's called a VBAC, a vaginal birth after cesarean. And the risk of that uterine scar rupturing a second time is extremely low. It's like less than 1%. So anybody listening to this, if you've had a C-section before and you're pregnant again, you do not necessarily have to have another C-section. You have options.
Yeah, that's good. So have you seen an increase in people requesting doulas? Because I wish I knew about one when I was having my children. I'm sure I would have had one by my side. So has there been an increase in requests for a doula?
There have, yes. So when I first started doing this work, back in 2015 here in Wichita, I was kind of, the Lone Ranger out here just doing it. And nobody really knew what it was. Nobody knew why they wanted one. But pretty quick, word of mouth spread. And people said, well, I want that for my birth too. People started to realize it's not just people having home births who can have doulas.
Mm.
And so it's really popular now. Lots of people want us there. We can't train doulas quick enough to get all the people that are needed out here. And what we're working on right now is actually making doula coverage something that Kansas Medicaid, and other insurers will cover, because we know
Okay.
it leads to better health outcomes and it should be a covered service.
And
So
I think that would be a good idea because I would think that having a doula by your side to kind of ease some of the ants that you have and fear that you have because of the pain that you're going through would kind of ease that process somewhat. What do
it
you think?
does. It really
Okay.
does. What it is just arming people with the knowledge that they need so they know what to expect, so that they're not afraid when labor starts. Because just like anything in life, the more we know about it, the less we're going to feel afraid or uncertain. And birth is one of those things, it's regulated by your hormones in your body. So if you feel safe and protected, you're going to have an easier, quicker labor. If you feel stressed, if people are making you feel uncomfortable, if you feel like you're out of place, people are picking on you, discriminating against you, your body is going to slow down the process of labor. And that's one of the things that leads to those higher C-section rates, because our hospitals, like it or not, are businesses, these hospitals. And so if you don't get in and out of that labor room quick enough, they're going to do things to start trying to speed that process up, even when there's nothing wrong with your labor as it's going.
Yeah, I can't even imagine. But what would your advice be to young women or women, period, to be a doula? Oh, before you answer that question, do you have men as doulas? I know there's women, but are men being trained as doulas or
There are not any
See?
male doulas, but
Okay.
there are across the country, there are some men who have been trained as doulas, specifically men who work in conjunction with their wives. So it's like one couple supporting another couple. That's starting to be more common. We do need more male doulas.
Oh,
Uh,
really? Okay.
yes, I really think so because a male doula, I think, would be more support for the father. We can't forget how important these fathers are too. You know,
Right.
they also need somebody to be there with them, to advocate for them, to make sure that they understand what's going on too. Because that
Right.
dad is usually the loudest advocate in the room for the mother.
Right, right. I mean, I didn't even think about that, but yeah, the men or the fathers need support as well. Okay. So what would your advice be if people are thinking about becoming a doula or even a midwife? What would you tell them that, what to look forward to when you're uh seeking that path?
Yeah, I would tell them that this is the best path. I'm a little biased, but it's so needed. It is so needed. Part of the truth of doing this work is this is revival of a community role that we had before it was taken away 100 years ago. And that piece that people always refer to, you go back and you grab that knowledge and you pull it back. You use it. That's what this is about. This is about us within the community showing up for the mothers and fathers and parents in our community and making sure that we hold their hands as they walk across that bridge to parenthood and that they get through safely. So it's the best work, but it's the hardest work too. You're on call. You never know when someone's going to go into labor. It could be
Mhm.
37 weeks, it could be 42 weeks of pregnancy. And so you're kind of always on the edge of your seat. But there is nothing like the rush that you get from seeing your client get through labor and turn around and look at you as she pushes her baby out, and you just see that strength. And she looks at you and she says, I did it. You get to
Oh,
hug her and you say, yes, you did it. You did this amazing thing. Look at you, you goddess. There's nothing like it.
okay. Well, like I said, Sapphire, I wish I had had that doula by me with my three births. I'm telling you, it would have sure eased my process. Absolutely. If people are interested in your organization or even donating or whatever, or becoming a doula, how can they contact you?
Yeah, so the easiest way is through our website. It's ksbirthjusticesociety.org. And
Okay.
I'll share that link with you too.
Okay.
And all of it's on the website, how to reach us, how to sign up for trainings. We have an initiative right now called the Matrescent Center. So it's our office that's up on 15th and Broadway, and it's a one-stop shop. We have free baby items, free maternity items. We have this thing called a self-care room, which I think is amazing. You walk in and it's beautiful. It's this green space. There's a big wall with a water fountain. There's plants everywhere, and it has tools for your self-care. So you go in there and it's all about you, how to relax, how to meditate, how to get you into that mindset where you can just focus on your well-being for a minute.
Wow. Well, Sapphire, thank you so much. And I hope I can call you Sapphire.
Yeah.
Okay, well, thank you so much for being my guest. I know you're busy. I was excited about hearing more about a doula because I've heard people say doula, doula, doula. I'm like, what in the world? Yeah, so like I said, I had the two mixed up, the doula and the midwife, and so I'm glad that you were here to explain that to everybody, me, and everybody else that was confused. And I think what you're doing is great, just great work. And so I hope that if people are interested, that they will contact your organization. Could you say that one more time, what the name of your organization is and the address?
Yeah, it's Kansas Birth Justice Society, and we're at 1540 North Broadway in the upstairs of that building. Yeah,
Okay. Well,
taking
thank
back.
you again. Thank
Thank
you. Thank you. Thank you. It was
thank you
an
for having
honor and a
me.
privilege to talk to you.
Thank you for having me.
Bye.
Bye.